We are also recording the meeting for our purposes. So let's begin. Mayor Gelber, you have the Zoom floor.
Thank you. Thanks, Veronica. And, I want to thank my colleagues from around the state, not just Miami Shores Mayor Crystal Wagger and and Mayor of Hialeah, Carlos Hernandez, but my friend, Mayor Rick Kreisman from St. Petersburg, and from Broward County, Sunrise Mayor Mike Ryan. The truth of the matter is that, we talk about the pandemic pretty regularly. We share the challenges that we're confronting. We talk about, what we think should be done and what shouldn't be done, and what's working and what isn't working. And so the reason why we are having this today is that, as we've talked about this, I think it has become pretty clear that what Florida is doing right now isn't working. It's unmistakably clear that Florida's approach to managing this pandemic is failing pretty horribly. Vaccine is on the horizon, but the truth of the matter is Florida cases are approaching 900,000. Yesterday alone, there were 85 deaths, adding already to the nearly 18,000 Floridians who have perished. This morning in my community, and I know probably, I was talking to Mayor Ryan about this the other day, in his community as well, blocks, people lining up for tests are around the block. New cases, hospitalizations are surging to levels we haven't seen since August. So, rather than just talk amongst ourselves and to our commissions and to our managers and to our residents, we thought maybe we should try to reach out in this way with each other to sort of try to give the governor some direction from our perspective that we think is pretty important. So what we're going to talk about today, and the mayors, some of which I think we agree about some things, but they may have some things that are particular to their communities that they want to emphasize and stress. But there are clearly a few things that we need to do. And I think the one thing that I would say from my perspective, and some of this is just my perspective, but the herd immunity that is being advanced by some of the advisors of the governor really isn't working. It's not protecting the vulnerable. We've seen that already. In my community, a small community, had 13 seniors who died in a nursing home. Positive cases are rising steeply, and it's spreading everywhere. So we don't believe that this is going to change unless we do something different. There's no reason to believe that these, devastating trend lines are going to recede unless we change what we're doing. So here, there are 4 subtopics, but within them are a lot of different ideas, but that I'm going to recommend, and I think my colleagues will probably agree in part or in whole. First thing is, governor needs to implement a statewide mask mandate. It just is needed. Across the country, governors of every political stripe are doing it. They realize that it is clearly, at this point, one of the few things you can do that allows you to open up the economy in ways that protects the public and reduces the spread. And we just need to have it. Second thing is we're asking the governor to allow local government to enact kinds of remedial measures addressing local conditions, including enhanced mask enforcement. As my city had done, we had issued 1,000 mask citations before the governor prevented us from doing any more. Capacity limits, social distancing requirements, and also to give local governments freedoms. And I know Mayor Hernandez is going to talk about this, to deal with their budgets in ways that are particular to this crisis. And also to have its meetings the way they want to, because I'm in a meeting now, but if we invite the public into a meeting, we encourage a situation that we probably shouldn't be, a very unhealthy situation. Third thing is to restore state testing facilities and operations to their fullest capacity. Right now, people want to get tested, and they don't want to get tested for no reason. They want to get tested because they believe they need to get tested. That's usually why people go get tested, because they think someone they knew or were around has the virus, and they want to go get tested. Right now, they got to wait around the block in my community, and I'm sure it's like that throughout the state. And the state has rolled back its testing facilities. We allowed the counties to fill in some of the gaps, but that's not going to last forever. The state needs to take control of this and has to provide full and available testing for everybody. And the last area has to do with contact tracing. We believe that contact tracing has to occur right now in a better way. Right now, DOH is not following best practices. In my community, for instance, in the week ending on November 13th, amazingly, the contact tracers were only able to interview a little over 40% of those people who were infected, which means close to 60% of the people who were interviewed were not even interviewed and never gave any information about who they had been in contact with or about quarantining or anything like that. And the other thing we think they should do is, Florida has not adopted any significant app to help in the contact tracing. There's been no online app that Florida has truly adopted. Now, Google and Apple have an enterprise app that is being used, but it cannot be used in a state unless the Department of Health allows it to be used. And in Florida right now, it's not allowed, which means that Florida, and in fact, local governments, don't have the ability to use that app. So we would also ask for the governor to have the Department of Health reports to him to please allow local governments to, in fact, utilize the Google Apple enterprise app, because in states where it's being used right now, it is proving to be effective, and it's something that is being denied the residents of our state. Since the governor opened up the economy totally in late September and simultaneously prevented local governments from enforcing individual mask mandates, we have seen an enormous surge. There's just no question about that. And because of the nature of indicators, because they're lagging, all these increases in positive are surely going to be followed by hospitalizations within a few weeks. So the increase in hospitalizations we're seeing right now, and in my city, we've had, I think in my county, we've had over 60 or 70 in the last week, which we haven't had since August. That's going to be that followed the increases from a few weeks ago. Well, the increases we just have seen, and we had over 2,000 on a single day in Dade County, is going to be followed in 2 weeks by even more hospitalizations. So you can't wait for this crisis to hit you in the head over and over again, like a brick. You've got to act beforehand, and we've already missed so many of those opportunities. A vaccine is on the horizon, but this pandemic isn't going to be in a rearview mirror for likely at least 4 or 5 or even 6 more months. And while I fully share the goal of reopening our economy and avoiding debilitating lockdowns, and I know the governor shares our view about the health of our residents, this approach is neither saving lives or livelihoods. Our state's primary economic engine is hospitality, and people will not travel here if they believe it is unsafe. In fact, I'm convinced that projecting our state as a place where people are not wearing masks and where the virus is allowed to spread unconstrained will only serve to discourage visitors. I've seen responsible people in my community, responsible entrepreneurs, really do a great job, hoteliers, restaurateurs, and business people, adopting terrific health and safety standards that foster customer confidence. That's what we want. Our way out of this is to enact those measures, and we're asking the governor to change his direction now, because the direction we're going in is, unfortunately, it's killing people, and we can't continue the way we're going. So with that, I'm going to ask my colleague, St. Pete Mayor Rick Kreisman, to say a few words, and then we'll go down the road. You got to unmute yourself, Mayor Kreisman. Veronica, or you got to unmute Mayor Kreisman. I want to hear what he has to say.
There you go, Rick.
There we go. Thank you. Thank you, Dan, for putting this together, and for each of my colleagues that are on this Zoom with me. Thank you. As mayors, we all know what we need to do to try and protect the residents of our communities, and it's just incredibly unfortunate that the positions that the governor has taken thus far have made our jobs very difficult. I look back prior to the governor entering the phase 3 order, and in my city and in our county, we were on a rolling 2-week average between 2.5% and 3.5%, and we were steady at that percentage. Then after his order was entered, and his order, like so many of the orders that he's drafted, created incredible confusion in our community, not just with the business community, but with the governments in our county, trying to understand what he was doing and what he wasn't doing. Within 2 weeks, we've seen our numbers substantially go up. And as Dan was mentioning, look, we understand the economic impact that potentially some of these orders could have. But we're also trying to look at this from a long-term basis as opposed to short-term. And if we don't deal with this now, the economic catastrophe that we are facing will be far worse if we have to go to a complete shutdown. Simply allowing us to put the processes and the measures in place to help us get our numbers back to where we were before. Having a mandatory mask mandate throughout the state so there's consistency. Allowing us as individual counties and cities to determine what other restrictions make sense, whether it's a 25% occupancy limitation, a 50%, whatever that number is that works for our communities, allowing us to do that and allowing us to enforce that can help us avoid the economic catastrophe that will happen if we don't get these numbers in place and have to go to a complete shutdown. And Dan mentioned herd immunity. Some of the healthcare experts have indicated that if we continue to follow that track, that this is the solution. There's roughly 50,000 Floridians who will die that don't need to die. Now, to me, everyone in my community, one death is too many deaths. And I find it hard to understand how the governor doesn't seem to be very troubled with the concept that there could be 50,000 deaths that take place that don't need to because we are following herd immunity. And you have to question the people he's listening to and he's getting his information from. I know all of us as mayors, we have access to some of the brightest medical experts in the country through the U.S. Conference of Mayors, through Bloomberg Harvard, and in our own communities. But yet this governor seems to be listening to Dr. Scott Atlas, who's a radiologist. This is not an epidemiologist. This is not an infectious disease specialist. He is a neuroradiologist. And his practice and his study has been on neuroradiology. And then the other person that apparently now is going to start giving us the data that we're supposed to rely upon is a former sports blogger and Uber driver from Ohio. You can't make this stuff up. And so we've got to have a state that follows the same rules and puts in place the same rules as so many other states around the country. And as Dan also said, this is not a partisan issue. This is not Republican, Democrat, red, blue, because look at Ohio, look at Governor DeWine is doing. There are 10 states in it right now that I can think of off the top of my head who have Republican governors, all of whom have had mandatory mask orders. And so you know, all it says to me is that for whatever reason, our governor has decided he is going to follow the lead of our president. And he's not going to listen to what the medical experts and the healthcare experts are saying. The four topics that Dan outlined, we are in complete agreement with. Having a statewide mask order, having the ability and the flexibility for us as local governments, whether we're city, county, or school board for that matter, to be able to make those decisions that best fit our communities is critical. We had 1,100 people tested yesterday out at our Tropicana field site testing that the county has put in place with state assistance. But in speaking with the county, they are afraid because the state has indicated they're pulling staffing. And so we're all going to be scrambling to see if we can staff these testing centers. So we're talking about decreasing testing at a time when we should be increasing testing. And lastly, having a robust contact tracing is really critical. All we're asking for as mayors is for the support of an administration in Tallahassee that is looking out for the residents of the state of Florida as much as we are for the residents of our community. So, thank you.